planning your assessment of an MDS patient, do you obtain a genetic test? When do you think it's important to do that? So is it a diagnosis? Is it somewhere along down the stream? And if it is downstream, what triggers your decision to do that?
That's an extremely important question, Dr. Behar. And I think that it's very important to stress that genetic testing is really mandatory for MDS for a number of reasons. Whenever I suspect an MDS, I do perform a genetic testing consisting in chromosomal studies, so karyotype analysis, that is really always to be done, even in very elderly patients, because it gives you the idea, not only gives you the assurance that it's really an MDS whenever some of these alterations are present, but also gives you an idea of the prognosis of the MDS. And anytime that I do test bone marrow situation conditions after a therapy, or even in a long follow-up for the patients who do not need a specifically aggressive therapy, it's important to repeat chromosomal studies because they may change, the alteration may appear that were not present at diagnosis. So diagnosis and prognosis are based on the study of cytogenetic alteration. But nowadays, we also implement such study with the gene mutation study. The molecular study are very important, and they may add another level of sophistication that is very important to define, to better define the prognosis of the patient. Sometimes it really helps you with the diagnosis when you have doubts because morphology is not clear and chromosomes are not all abnormal. This is really useful. It is very important to evaluate how much these genes are mutated because sometimes it's a mutation that is not present in very many cells does not mean that the patient is an MDS for sure. It may be related to age, and age is carrying also the possibility to alter some genes without being a necessary disease itself. And in the end, I will test anytime also, I retest bone marrow in an MDS because additional genetic mutation may appear. Gene mutation may be targeted, and especially after an aggressive treatment and relapse, MDS may show mutations that were not present at diagnosis. And this may allow targeted therapy with specific agents. Some, very few actually at present, are mutations that may be specifically targeted, but nevertheless, for the small percent of the patients who will present, this is very important. So anytime you reassess the condition of your disease, anytime you have a follow-up, you should include genetic testing, both chromosomal and molecular for gene mutations.